Auckland University of Technology. She is breaking the wall of unsuccessful stroke prevention.
In New Zealand, stroke constitutes the third leading cause of death and disability. Long-term changes in lifestyle risk factors can reduce stroke risk by up to 80%. To date, national prevention programs, including our award-winning Stroke Riskometer mobile app, have aimed to educate people on these risk factors in order to inspire a behaviour change from being risk-inducing, for example smoking, to risk-reducing, quitting smoking, with relatively good success. However, what happens after the change is established and the awareness program is complete? This scenario is the biggest downfall of awareness-based prevention, where the individual loses interest over time to maintain change and revert to original habits, basically back to square one. To initiate and to sustain health behavior change requires motivation, a concept which is not given much focus during the design of awareness-based prevention. My mixed methods research study, utilizing stroke riskometer users, looked at three key mechanisms integral to facilitating motivation and are relatively under-researched in New Zealand's stroke prevention paradigms. While participants are aware of the health impacts of risk behaviours, including stroke, they still choose not to engage in or maintain change. Firstly, if they feel they have a low tendency to develop a stroke or a chronic condition, they have inadequate support systems, or feel barriers such as the habitual nature of risk behaviours overweight the benefits. Secondly, nutritious food consumption is significantly lower in socioeconomically deprived individuals or those living in deprived communities, as they experience significant food cost concerns and prefer food sources that are easily accessible, these typically being takeaway shops and fast food outlets. This is a major finding, given the high correlation that exists between New Zealand's most stroke susceptible and socioeconomically deprived groups. Finally, risk behaviours are highly favoured during chronic psychosocial distress to evoke easy and instant, albeit short-term relief, inhibiting motivation. The study achieved an overall response rate of 93% and was cost-effective, utilising online surveys and video call interviews. This research is a game changer. Breaking the wall of unsuccessful stroke prevention requires moving beyond education and understanding what it is that motivates an individual to change lifestyle risk factors through client-centered prevention management in clinical practice. Thank you.